Well, I am thrilled to welcome here today Dr. Rob Fields to be able to share a little bit about the incredible work that he's been doing and the things that he's been writing about through the pandemic as he's taken a lead in New York. Dr. Fields, welcome, and maybe you can start by sharing a little bit about your background.
Sure. Thank you for the opportunity, Gil and Bunny. I can't thank you enough for helping spread the message of what we need to get done in this industry to establish equity in our communities. But yeah, so I'm a family physician. I'm currently the Senior Vice President and Chief Medical Officer for Population Health. So, sort of fancy title, but I always start with I'm a family doc first. When we started this work back in late March, early April, as the pandemic hit, what was starting to happen is that our care management teams were receiving inbounds, right? They're already used to doing outreach for high-risk individuals. They were getting inbounds from all sorts of folks saying, I'm having behavioral health issues, increased suicidality, anxiety, food insecurity issues, et cetera, long list of things. And some of the services that we could offer to address those required broadband, Wi-Fi access, et cetera. And it became really clear that a lot of our most vulnerable folks didn't have it. Education had an imperative to solve it today, right? Because they had a bunch of kids at home. All right, well, now let's use that as a potential solution. So if the schools were able to distribute cellular-enabled laptops or tablets, that now provides access in the home that can be used for other things besides education. Can we piggyback on that infrastructure and start to chip away at, all right, with this particular population, how can we engage them in such a way that they can now use that tablet to get a telehealth visit?
Tell us what you're doing with the Dream School, what Mount Sinai is doing in the community.
We're partnered with the Dream School, is a public charter school in East Harlem. They serve about 1,200 kids, K through 12, who predominantly come from NYCHA buildings that are very close. So almost by definition, when they get in the school, these are vulnerable populations by definition. And the advantage there is that the Dream School, they're not just teachers and social workers. They have a relation. They take a whole family approach. They engage the entire family. They were already trying to solve food issues for their families, things like that. And what they have, which we don't have as a health system, is a relationship with that community that's well integrated, and the families are engaged. They respond to the Dream School. They answer their calls. And so what we have been trying to work on with them, or have been working on, is everything from, can we provide asthma education in the midst of a pandemic? So we use the laptop they have in the home to provide widespread, not only education, but interaction. Like the parents could ask questions and put in the chat with physicians. Like, when does that happen for someone who lives, probably anywhere, but certainly in public housing.
How do you and Gil work together on the telehealth equity?
So early pandemic, it just became very apparent that all of the issues that we saw around COVID-19 and how it was disproportionately impacting marginalized communities and vulnerable populations was not a separate issue from what we saw around the murder of George Floyd and systemic racism, but they were intimately related, and the same challenges were affecting healthcare delivery. And as the world moved to virtual, we had a few early conversations with people that highlighted how this was exacerbating existing inequities for all of the challenges that Rob had alluded to. There's the digital divide. The safety net providers don't have the same technology and services infrastructure. And there's really not a focus on being able to allow those populations to access health services virtually. So it's really about finding folks who are doing this incredible work and amplifying it and bringing resources with a really bold goal to improve access to care for 100,000 people in communities of color in New York and 1 million people across the country. People can go to the Health Tech for Medicaid website, ht4m.org, and look at our telehealth equity campaign and get involved.